Welcome to the Friends of NPACE Podcast, brought to you by Haleon. As a leading global consumer healthcare company, Haleon is dedicated to delivering better everyday health with humanity. Known for trusted brands like Advil, Excedrin, and Voltaren, Haleon leverages science, innovation, and human understanding. Haleon is proud to collaborate with NPACE to educate healthcare professionals about our pain portfolio and the latest healthcare information. For more information, visit www.haleonhealthpartners.com.
Welcome, everyone, to the Friends of NPACE Podcast. I'm Terry Schmidt, family nurse practitioner and NPACE executive director. And I am so humbled and honored and excited to get to podcast again in season 3 with a woman who never ceases to amaze me and inspire me and mentor me. We have today Dr. Mimi Secor. She's served at NPACE for many years. She's been a speaker. You are on the board of directors. You still serve on the board of directors as consultant. You're a nurse practitioner, national speaker, educator, #1 best-selling author, media ambassador, and painter. I know. Then the one behind you. Wait, is that one watercolor? What's the one?
Yeah, this is watercolor. I did this last year, and I'm working on one similar to it right now.
Oh, I love it.
I know, isn't that wild?
Yeah. Oh, it's so beautiful. I know we auctioned some of your work off at one of the events when we were raising money for student seats. So thank you.
Always fun.
Yeah, but we have you here. You've been extensively published. You have your best-selling book, Debut the New You, Transforming Your Life at Any Age. And yeah, we're going to talk about actually that aspect today in caring for self. But you also have written all the editions of the Advanced Health Assessment of Women's Skills and Procedures, that one for Springer, and Fast Facts about gynecological exams for nurse practitioners, PAs, and midwives, because yes, all APPs. You're senior faculty with several organizations. You're with APEA. You're a fellow of the American Association of Nurse Practitioners and the American Academy of Nursing. But really, it's that fitness and health aspect that we're really interested in. And you've talked about that before, right? In some of your media. Was that what you did with Good Morning America and the Wall Street Journal, Boston Globe?
Yes, actually, it's always been a focus of mine in the media work that I've done, but I've also interwoven it with the role of the nurse practitioner. So it's kind of either one or the other, or commingling those two topics in my media work.
I love that. And you got the Cutting Edge National Leadership Award for pioneering and career contributions to the NP profession. Look, you had a practice back when no one had an independent practice out in Cambridge, seeing the people.
I just felt like I have something to offer. I know other nurse practitioners that have something to offer. And if we're unencumbered by a constraining healthcare system, just look at what we can do. So I just left Mass General's emergency room, worked with a midwife in private practice. She took off and did international work. She said, enjoy this practice. Next thing you know, I was just doing what hairdressers do, spinning off my own practice in Cambridge and enjoying it so much for 12 years. I just absolutely loved it. I had 6 nurse practitioners working with me at one time. We just had a flourishing practice. And always focusing on education. We would have a lot of seminars and other clinicians would come in. And when Good Morning America came and filmed in 1993, they spent the entire day filming interactions with patients and talking with us. It was pretty amazing.
Yeah, that was a big deal in 93. Look how far
it was such a big deal to have nurse practitioners in the national limelight. I remember being a nervous wreck.
I bet you were, but you're always so good in front of an audience and just talking to people. And
well, thank you. The way I always think about it, and I talk with my good friend Dr. Amelie Ollier a lot about this, fellow nurse practitioner speaker, that if it looks easy, it probably isn't. That it takes a lot of preparation to really have a smooth, comfortable interview, whether you're interviewing someone like you are interviewing me today, Terry, or you're the guest. So you never want to just go in and say, oh, I'll be fine without preparation. We wouldn't do that when we see patients. We should never do it with the media interviews either.
I totally agree. We're putting our best foot forward, but really, thank you for laying the groundwork for all of us as advanced practice providers to really be where we are now and provide access to care.
Well, thank you very much. I feel like I had a lot of early mentors myself. I was, the young nurse practitioner on the block at the early NPACE meetings where the founders of the NPACE organization mentored me in giving introductions to speakers and how to run conferences. And just they inspired the heck out of me to step it up as a clinical nurse practitioner and educator. And I have the founding, mothers of NPACE to thank for that. And certainly my early community, many of whom have unfortunately passed on. So it brings us back to self-care and taking care of ourselves and all of that.
It absolutely does, because we don't do any of this alone. It's in community.
Right. Never.
And
if you try to do it alone, you're doing a disservice to yourself. And that unfortunately happens to too many of us.
I completely agree. So you and I have talked about self-care at least twice on this podcast.
At least.
Why should we still be talking about it? What's going on?
Well, I think healthcare is in a crisis, and nurse practitioners are right smack in the midst of that crisis. So we've gone from basically nonprofit models in the early decades to for-profit models that really almost cracked the whip on us in terms of having us see patients very fast and telling us, geez, you're still not seeing enough patients. You need to step it up or you're not going to get your bonus, or, certainly you won't get out of work on time. And, now clinicians are doing their charting at night and on weekends. And that to me is just completely out of control. That is really bastardizing the concept of having a professional role, in my opinion. So we don't work hourly, we work as professionals, which means, if we don't get out of work at 5 every day, that's fine. But we shouldn't be doing work every single evening and on weekends. And that's having a huge negative impact. Now, even if that's not happening to clinicians at work, work is becoming more and more intense as systems want us to see patients more quickly.
Yeah, I completely agree. I feel that pressure constantly in clinical.
Mm-hmm.
The other thing that I feel deeply in my soul is this moral distress from trying to treat patients appropriately and just constantly fighting for patients, filling out prior authorizations that get rejected, having patients tell me they can't afford the copays on their meds. Like, it's happening more and more. And I just carry that around all the time.
Well, and to admit that, Terry, is really important, that moral distress. And do we address that in nurse practitioner programs? Do we address that at conferences? It's so critically important to see that, label it, and then do something with it. What are we going to do with that distress? Because just carrying it with us every day, 24 hours a day, many of us think about our work distress a lot. It's too much. And we have to figure out a way to unbundle it and be able to create a self-care plan to deal with it.
Mm-hmm. All right, we're going to get to that. But I guess my first question is so what? So we carry around all this stress, like what? Is it affecting us? Is it affecting the patients? What kind of outcomes?
It affects everyone. It affects us and our health. It's not good to have elevated cortisol levels. And that can translate to inflammation, increased risk of cardiovascular disease. I'm very concerned as a cancer survivor about increased risk for cancer. And I don't think having elevated levels of stress uninterrupted day in, day out, year in, year out, decade in, decade out is good for our health. Now, it also translates to patient self-care, patient care, and patient safety, because the more stressed you are, the less care you're going to take with your patients. Now, you may be thinking that you're taking good care of your patients, but we know if you're rested, if you're happy, if you're feeling good, then your brain is going to work better. And if you have to see patients in shorter periods of time, that thought process is going to work better too. So the best thing we can do when we have to cope with these situations is actually ramp up our self-care, which is counterintuitive, completely and totally counterintuitive.
Okay, I appreciate that. So where do we start? What counts as self-care?
Everything counts. So anything and everything that we can do to improve our health in a healthy way. We're not talking alcohol. We're not talking extreme caffeine. We're not talking about complaining. That's a very negative habit. Complaining is what everyone does in healthcare systems. The
Yeah.
best thing you can do is not buy into that too much. You can listen to people, but the more you buy into that frenzy, the more that's going to create stress for you as well. So we have to kind of break that unhealthy culture up and how we manage our stress. So we can listen, but we don't have to take it in. Like many of you probably know about Mel Robbins' new book, Let Them. Terry, I'm sure you know about it.
Mhm.
And the idea being that you can empathize, you can, be a wonderful human, but you don't have to take on everybody's stuff. You can just let them do what they're doing, think what they're thinking, and you can manage yourself. That's really the only thing we have control over, our behavior, our thoughts. And that's critically important to remember when we're entrapped in this unhealthy healthcare system. I say entrapped because we are really trapped.
Yeah, we are. And to even be motivated to make change is really going to help be important to do what you just said. So embrace the positive, look for where we can do good, and then just let the rest kind of go.
Exactly. And that's where, just simple techniques like taking a big deep breath and just clearing your mind. I always like the mantra, peace, love, joy. When I'm taking a breath, when I was working clinically, I would often do that in between patients. Just a way of centering myself so that I could be there for the next patient. Even if I had a waiting room full of patients, I could clear the deck, so to speak, in my mind and connect with my heart and then, see that next patient. So that's a simple technique that takes literally only a few seconds. And it can be the difference between a miserable day and a very positive day for both you and your patients. Because if you think you're hiding your stress from your patients, you're wrong. And I can tell
Right.
you right now, I knew in the hospital when I was receiving chemotherapy, who the nurses were that were taking care of themselves, who were sincerely happy and connected with me versus the ones that just wanted to come in and hit and run, get their stuff done and run out of the room and had really negative energy. And that you want to have positive energy. That's very, very therapeutic for patients, whether you're outpatient, inpatient, any setting.
I
Right?
love that you said that. That's great. As you were saying that, I just took a big breath in and just kind of let it go and lower the shoulders. So that's a
Right.
really good thing
Lower
to
your
do.
shoulders. What's
Yeah,
that?
that's a
Make
really
believe you
great
have
thing to
hands
do.
behind you, lowering your shoulders.
Okay, we're trying it.
It's
All
not
right.
easy. We get in that frenzy. It's like another phone call in between patients, which reminds me of something you can ask as a clinician at work. You can ask your healthcare system not to interrupt you when you're seeing a patient. And more systems are requiring that because it's such a patient safety issue to be interrupted while you're seeing a patient. Something to
Okay.
think about.
So I was going to ask you what would we say, or what can exhausted clinicians do who are in clinic all day? So we already have one is take a deep breath between patients and
Right.
just release those shoulders. Two is ask your health system not to interrupt you at all when you're in a patient room. I would encourage clinicians not to carry their phone in there or to silence it or
Absolutely not.
airplane mode.
No, absolutely not. And don't check it when you come out from seeing your patient. Like the only thinking time we have is when, we step out for the patient to get undressed, and then we finish our exam and we step out again for them to get dressed. That is such a little bit of time to figure things out. Say you're seeing a patient and nobody has thought about the possibility of that patient's symptoms being cancer. And you're in a rush and you're checking your phone and you're answering phone calls and helping the medical assistant deal with
Yeah.
whatever their issues are, and you miss it. And multiple clinicians miss it because it's an unhealthy environment outside of the patient room.
Yeah, and it's feeding our stress. So what else? If clinicians are working full time all day, every day, what else, what are some other things they can do, especially if they're exhausted,
They
to
can
take care
hydrate,
of them?
because if you
Hydration.
have a headache or if you're tired, you may be dehydrated. So many of us at work, we don't want to drink too much because then we'll have to pee, and heaven forbid we have to pee. We can see a patient in that amount of time. It's just a crazy rat race. So take time to drink water. You should need to use the restroom every couple hours if you're drinking enough water. If you're going the whole day without voiding, that is unhealthy for your body, and it's going to shorten your career. And it's going to affect your brain, because what percent of your brain is water? I always love this fun fact, 73%. Isn't that crazy?
Yeah.
That's like, wow, you want to think better, drink more water, get a little more sleep, reduce your stress in simple ways. How about eating at work? I never wanted to eat at work because I'd get things in my mouth, in my teeth, and then, I'd have to pick my teeth before I saw another patient. So I got to the point where I would just, eat yogurt, but Greek yogurt's pretty good, high in protein, good for you, pretty easy to eat. I always thought, gee, if I could just take it intravenously, that would even be more convenient.
Trying to be
Just
efficient.
hook me up with a Greek yogurt infusion, please.
Oh, that's so
But
funny.
we cannot go without sustenance during the day. It's unhealthy.
All right. So make sure we eat and hydrate.
Right?
Yeah, breathing between patients, not being interrupted. How do you feel about, because in nursing, we've been told not to take off, right? You've got patients scheduled. Don't you call in sick. There's no other provider. What do you think about taking a mental health day when you really need it?
Then you need it. When it gets to that point where maybe you're crying on your way to work, you're really feeling that kind of anxiety, maybe you didn't sleep the night before, that's a legitimate reason. It's just like if you had the flu. If you're that distressed, you need to just forget the implications of calling in. They'll figure something out. They'll call the patients, cancel them. They'll fit the urgent ones into other clinicians. And as long as you don't abuse the system, that's legitimate. Now, abuse the system can also include if you're not taking care of yourself, then you may need more time off than if you're taking care of yourself. And then that can be a pattern that the system sees and can kind of come down on you. We all have worked with people that are calling out sick a lot, right? And often those are the people that are stressed, and we need to take responsibility for our stress. We really do. Even if the system's at fault, we have an opportunity to step it up and challenge ourselves to manage our lives as best we can at work and at home.
Yeah, we owe it to ourselves. If we don't take care of ourselves, no one else is going to.
Oh my gosh. And the worst part of working when you're stressed is you're living an unhappy life. And we don't talk enough about happiness, but we want to be content. We won't have that joy in our heart to interact with the world if we're really stressed. We're just going to be kind of a nightmare for ourselves and for people around us. So I think you're right. It robs us of our delightful, wonderful life that we could potentially live. And if you have a close encounter like I had recently, you realize that you really don't want to squander your life. You really don't on stress. That was a big wake up for me because I spent most of my career very stressed.
I think that's really good advice. I'm going to go tangential here, in one of those mentally exhausted things that I've found that help, that I know you do too, is I've found a half an hour to an hour of Reiki or massage therapy, not because it's self-care, but because it's a time for healing for me and to turn my brain off. I don't have a meeting. I don't have a call. My phone's not dinging at me. How do you feel about that?
I absolutely agree. Those sacred times, whether it's with a therapist that does Reiki or a therapist that does talk therapy, getting a massage, a dedicated time when you're off the clock, you're completely off the clock, is critically important. And I think that not enough nurses get therapy. I've been in and out of therapy my entire life just to cope with life, just
Yes.
literally to cope with life. And I was very lucky that I understood the importance of that even in high school and college. So whenever I'm in a crisis, I always think, oh my gosh, I need to see my therapist, which has changed over time. They've moved away. I've moved away. I've had to find other people. Now I have this fantastic therapist who does Reiki at the end of the talk session. I mean,
Oh,
talk about it. It's heavenly. I walk out of there, I'm so disoriented. Like, I just
you
had
just
my
like
session yesterday.
floating a little bit. I love it.
Oh my gosh. And just imagine you're a stressed out clinician, you, Terry, stressed out clinician, me, stressed out clinician most of my career until just a few years ago. What a difference that can make in your life. That can bring the joy back so that when you do go back to work, it just feels a lot better to interact with all those patients.
I agree. I'm glad you brought up therapy. One of my biggest regrets as a human is not starting that earlier in my life. And just like needing massage therapy or I know when I need a tune-up or when I'm having an issue I need to talk through and get more tools and get healing on. Everybody should have a therapist, just like they have a dentist or a primary
I
care
totally
provider.
agree with that. And if you're lucky, it's covered by insurance. But if you're gainfully employed as a nurse practitioner, you should be able to budget to be able to pay for things like therapy and Reiki and massage. Maybe not every week, but enough to be able to manage yourself in a time of just sort of moderate stress. If you're in extreme stress, you may need these self-care therapies every week or even twice a week. It depends on what's going on. But hopefully we're going to, through this discussion, help you not reach that crisis point. We don't want to lose you to that kind of crisis. And some clinicians are leaving clinical practice as advanced practice clinicians because they just have given up on the system. They've waited too long for all that self-care that we're talking about today.
Yeah, I want to empower them to start. Where should APPs go for inspiration or advice or motivation to like do these things other than you and I talking to them?
So many places to turn. Like I know NPACE is doing more and more self-care at conferences. So you're offering yoga on the beach if we're down at Cape Cod at the Seacrest, and more self-care like dancing at our receptions. And dancing's a wonderful way to shake off your stress. You can do that at home. Just put your favorite music on at the end of a crazy, stressful day and dance with your kids or your dog or your cat. Try a hula hoop once in a while, which is tremendous exercise. You can jump rope, even without a jump rope. Make believe you're jump roping. That's such good exercise. When was the last time you jump roped without a jump rope, Carrie?
Actually, I do that as warm up sometimes, especially when I go to kickboxing class, but I have a jump rope, Mimi, and I love it. And I used it this week.
That's so fantastic. It's so good for coordination and for cardio. And we know now short bouts of exercise are profoundly helpful for our health, profoundly impacting of our health. Most of you have probably heard about the benefits of taking like a 10-minute walk after you eat dinner.
Yes.
Even for you at work, if you are lucky enough to have the luxury of an actual lunch with an actual maybe time to go walk after lunch. I never had that experience in my work. I just didn't. But I hear that's a possibility. Even when I had my own practice, I'd just work straight through and then I'd get out a little bit earlier than normal, like mid-afternoon, get home, and then I would take care of myself when I got home. But I just preferred that cycle of work.
Yeah, I'm a morning person. So like I can feel through the day if I didn't get up and move a little bit, and I carry this. So I got to do it in the morning because my brain is so fried by the evening that I'm not motivated to go
Well,
move.
and that's very human, Terry. That is more common than not.
Okay.
Unfortunately, if you're a clinician, you got to get to work early. It may be too early for you to be able to get up. Some people are able to get up at 4:30, 5 o'clock and work out before they go to clinical. I was never one of those, but I hear you, and I much prefer working out in the morning. So maybe on weekends you can do that if you're not able to train yourself to be an early riser.
I like that. Yes, we do that here at NPACE. We're trying to help people pull in, and we have some YouTube videos on wellness and yoga, and we have it all over the place sprinkled in. You had mentioned classes, And I have to tell you that when I went to a gym that had, it was a gym membership, but had group classes that you could participate into, that was a game changer for me. Those women
Mhm.
got to know me. You show up, you start chatting. It's an hour of fun, whether it's Zumba or weightlifting. It changed me forever. Classes
So
at the
Terry,
gym.
the beauty of that is you have community, and we need
Yes.
community separate from work. We need that. So the classes are so helpful, and you get that energy from your new friends and from just being a part of that community, moving together. I love that. And I think I'm going to have to join another gym because Planet Fitness doesn't have classes this winter, because there comes a time like this morning when I'm not going out bicycling when it's 30 degrees. I'm
Yeah.
not doing that. And I have so much trouble walking now because of my feet issues that just I think I'll have to go to classes.
Classes
And
are
I'm kind of
fun.
excited about that. So thank you for telling me,
You're
reinforcing that.
welcome. I know. Planet Fitness, a lot of you in the Northeast, you need some classes. I'm just saying.
I know, it's so true, so true. And I have a dream of taking tap classes and hip hop classes. And, as long as I keep my feet moving, I think they'll be okay. It's more when I'm standing or walking that they're not okay.
Yes.
So it's like, bring on the rap, bring on the hip hop, bring on the Zumba. I don't care. I'll do it all.
I would love to take a tap class, but we did that. We had an old lady hip hop class and an old lady
Yeah.
Caribbean dance class. It was like Zumba, but it wasn't. Oh, so fun.
How fun is that?
It
Because we
was
got to
fun.
get our hips to move again.
Mhm.
Sometimes we're just so locked up over the decades that it's critically important to kind of get that movement back. That's why I'm a big fan of hula hooping and dance classes like that. So good for you, Terry.
Thank
I
you.
remember you dancing at our reception.
Ah, we had so much fun there, but I always like a good dance class. I
Oh my
do.
gosh, absolutely.
Okay, so if we're going to take home three things from what you and I have talked about today, little things, because I know people carry this guilt, like, I don't have time for the gym. I'm driving kids around. I'm making lunches. I'm working all day. Three
Right.
things that clinicians can take with them.
I think one of the easiest sort of things to remember in your brain is eat, drink, and be merry. Now, I'm not
Okay.
talking drink alcohol, but you want to remember to eat. You want to remember to drink healthy fluids, and you want to remember the importance of a positive attitude, be merry. And one of the ways we can do that to kind of reframe our brains away from all the negativity is thinking about gratitude and thinking about gratitude journals. If you're a writer, gratitude journals are great. I'm not. I like to just think about whatever. This morning I woke up and I was so thrilled to look out the window and see the birds at the bird feeder, because I thought, man, they must be freezing cold this morning. And so we gave them some fresh seeds, and the cat loves to watch the birds and the squirrels, and I love to do it. It's just a wonderful way to start versus turning on the news and getting depressed. It's like, okay, how about if I start my day a little slower, a little quieter? Anyway, so eat, drink, and be merry. Easy for people to remember, right?
I like that. Eat, drink, and be merry.
Right. We all want more of that.
Yeah, I think that's a great thing. So we're going to do that. Maybe just breathe in between patients, take sick
Exactly.
days if we really need them. Make sure we have a therapist in our back pocket.
And we didn't talk about it, but it's important to remember that you can do a lot on weekends, but you don't want to do too much. You don't want to overload your weekends. Like you might decide, well, I'm going to do a little food prep so I don't have to worry so much about midweek. Great idea. Maybe you can get one of your household members to help you with the food prep. Maybe there's services you can buy in order to not have to do everything. Like maybe somebody, you order your groceries, you go pick them up, or maybe they just deliver them. Sometimes we forget that we can get help. And some of you watching this may know already, boom, I'm a younger clinician. I know about all that. I know about Uber Eats. I know about this and that. Well, great. Some of us of other generations have been raised to think we have to go get our own groceries and do all our own chores. We can buy services. That's so important. Do you have somebody that can clean your house once every couple months? Maybe not every week, but maybe you can afford every few months. Wow, what a wonderful feeling that is.
Yeah, and what a gift to come home to. I like that.
So
One
the
of the
weekends, weekends, just that as as three things. Think about what you can put in the weekends without overwhelming your weekends.
Okay. So weekends also, don't overwhelm them. Take some downtime or your days off.
Unscheduled time. It's so contrary to what we
Scheduled
think
time.
of as highly structured workaholics. Many of us are very, very highly structured, organized workaholics. I don't know who I'm talking to right now about that.
I'm feeling everything.
Most of the leaders in our profession are highly organized, productive workaholics, right? And I think it's important to see what that label means for us. What is it about your life that is taking a hit because you're so productive? Work related, that is.
I think that's true in productivity. One of the things you always ask me every time you see me, not only how am I doing, but what am I doing to take care of myself? Like you never fail to ask that. And it
So
always
you're doing
stops me.
pretty well at that, I think, Terry, right? You're doing
I'm
pretty
trying.
well at that. Well, we're a work in process, right?
We are. Yeah. Yeah. And you encourage people to say no to things, to let some things go.
Right.
Can't do
Right.
it
I've
all.
let some board memberships go. I've said no to different speaking gigs because I don't want to be traveling weekly like I used to. I just realized my sound was on my computer because
That's
I
okay.
was watching a painting class, so I got to turn that laptop off. Sorry about that.
No, you're fine. We interrupted I love that you're watching a painting class.
I know. Gosh, I've only gotten this far though. It's sort of a fall Halloween-y background, and I'm not quite sure what I'm putting in yet.
I love it. I love that it's
What do you
just,
think?
I
What do
don't
you think?
know. What should be born there? Let me think about that. I love fall. It's my favorite time of year.
I know, I love it. I love this picture, but I don't want to do that. But I like the idea of that haunting image. The
Maybe,
flow of the paint. I like the flow of the paint.
yeah, very good. I love it.
Maybe
my
that's something you would like to try. Maybe take a class in pottery or painting or gardening or a dance class like we were talking about, maybe ballroom dance. Just something out of the box that maybe you haven't tried before.
Yeah,
Imagine
I
that.
do need to do that. You're right. Any parting thoughts before we go for the clinicians? I really appreciate you being here talking about this.
I appreciate you asking me to be here, and I appreciate that you are really emphasizing self-care for our busy clinicians. And I want to thank all of you that are watching this for your service to your community, to your profession. And I want to tell you that you're worth it, that self-care is a way of respecting yourself and respecting the community you serve. So you're not doing anyone a service when you just let yourself crash and burn. And we want to hold ourselves up as role models. And one of the best ways we can do that is to show that it's possible to take care of ourselves, even in the midst of extreme stress.
That was beautiful. I appreciate that. Thank you so much, Mimi. This has just been excellent. I hope everyone that's out there listening has just taken a breath and relaxed and let everything else go during our time together. All of you, all APPs out there, thank you for your service. NPACE is grateful for you. We invite you to join us at a virtual event where we have wellness at virtual events too, or our on-demand. We do. We have breaks where we do meditation and stretching. We put them in between the talks, Mimi.
That is so wonderful. I love it. It's like my dream. Your model is my dream model of how I sort of think about it.
I know. And it's so great. It's really like dessert for your body in the middle of the day. It's just relaxing and lovely.
So good for you.
Yeah, it really is. It's just delicious. Mimi,
delicious.
Yes, delicious. I just think those little
that.
15-minute breaks are so delicious because my brain just loves them. You have spoken for us before. You're an excellent women's health educator and health and lifestyle educator. So if any of you want to see Mimi in action, you can come to a live event. We have 2026 events out, but also we have on demand too at our learning center that you can learn from Mimi. She's always
Great.
teaching us. Thank you, Mimi.
Thank
Find
you.
all things NPACE at www.npace.org. We're an ANCC accredited provider, and now we have CME credit with every event through AAPA because PAs and NPs, the APPs of the world, are providing a phenomenal service to humans across the U.S., and we want to take care of
We
you.
often are working with them hand in hand in clinical practice. So it's wonderful that we have that opportunity to offer them CE credits as well. So thank you, Terry, for that.
You're welcome. I agree, and I appreciate the staff at NPACE letting us do that. Right?
Yes.
It's a dream come true.
Hug to all of you. Mwah.
Thank you, Mimi, for being here. We're going to sign off for this one. Thank you, everyone, for joining us, and we'll catch you on the next episode.